he quickly gets a reputation as sort of the doctor that people want to see when they can't get an answer from going to other doctors. And he ends up with a pretty complicated patient panel, and he takes those people on and really works tremendously hard, just trying to figure out how to help them. He goes through all of their old visits, their medical records, paper chart. He'll try and pull it all together, more than I've seen anyone else do, including working well into the night with driving past the clinic, see the lights on in the clinic room, really late at night, and it's always him there, just researching patients or reviewing countless abstracts to try and find a clue to just help these individuals. And he does that consistently, over and over again. And he also doesn't really get recognition for a lot of this work. He just keeps going along, really doing it for the right reasons. And really, he does deserve recognition for the tremendous impact he's had, both in Nisga'a Valley and really across many communities in rural Canada.
I know in his time here, he put a lot of work into making sure we had good quality healthcare in Clearwater. There were times where for either days or for months at a time, John was the only doctor in town, working to make sure our emergency department was still open, that our patients were getting care. He's been here till the evacuation orders have come down for some of the forest fires, keeping people safe and seen during the evacuation alerts. He worked on part of a pilot program with the St. Paul's International Medical Graduate Residents. Those are residents who usually end up in rural sites that are underserved. So he wanted to make sure they were getting exposure to rural medicine earlier in their careers, both for the understanding of what that rural medicine looks like, but also to try and instill some of that joy of rural medicine and the realization of just how much you can do in it. A lot of people have struggled to accept that, after his hard work here, John's tried to move into retirement. So we keep bringing him back for locums, so he's not fully out yet.
Francois is a deeply kind and empathetic person. He has the biggest heart of anyone I've worked with. He just really cares about people and their outcomes and their families and what's happening to them. He lives a life of service. So he has come to this community and the other communities he's worked in, I think, with that feeling that he is here to help, and he is here to be someone that can be trusted, someone that can be counted on. He is a tremendous clinician. He can listen to somebody's chest and hear 5 things that most average, even excellent physicians probably wouldn't notice or pick up. And he has been an instrumental and important person in our community for a very long time, both in the delivery of health services, but also the reform of health services, the addition of health services. And he's just a genuinely lovely and wonderful person who has committed himself to our community in a way that deserves recognition, even though he remains humble and would never ask for it.